Good afternoon, good morning, aloha, and all the other things that happen at the top of the hour. We are ready to welcome our luncheon speaker here. Very, very honored to be introducing Governor Josh Green. He is a proud husband and a father. He is an emergency room physician, and most recently, among his many, many accomplishments, he was inaugurated as governor of the state of Hawaii. For the past 20 years, he has provided health care for Big Island families as a physician, and he was elected to represent some of the island's rural communities, serving both in the House and the Senate from 2004 to 2018. He then was elected to the role of lieutenant governor, and he greatly expanded that role by spearheading the largest healthcare response in state history during the COVID-19 pandemic. There's probably a word for people who are in the House, the Senate, lieutenant governor, and governor. I don't know what it is, but maybe we can think of one over the lunch hour. Certainly committed, public servant, healthcare hero, a few of the other phrases that come to mind. All of this great work has resulted in Hawaii being very fortunate to have an experienced, caring, and humble leader who is prepared to take on tough challenges facing the aloha state, and most importantly, to speak to us today about an issue near and dear to our health, our hearts and our health, which is health care, and also his vision for the state in general. So please join me in welcoming Governor Josh Green.
Aloha. So there are terms for a person who would serve in the House, Senate, lieutenant governorship, and governorship, and it usually is crazy bastard or some other term, but really, it's the greatest honor I've ever had. So I want to start off by saying to State of Reform and to all of you friends, just thank you. Mahalo for your support over all these years, because there have been moments when we were kind of tilting at windmills on many issues, but it's because we care about people. And that's what we're about in Hawaii. We try to make decisions based on our values. And my speech or my presentation is going to be based on that mostly, where I just riff with you about things that we've done together, things that we might export to other parts of the healthcare world, things that you have supported so generously. All of this is meant to say healthcare is not a singular monolithic thing, but it is caring about people, and that's what we're taking to our cabinet. And again, it's because of you. It's because of how you fostered me all these years. So thank you. Thank you for everything. So I'm going to dive right in. So State of Reform asks us to consider the big questions about healthcare in our towns, in our states, in our regions. And I'm going to start right off with this first slide, which is me in scrubs doing what I do, which has been being a family doctor with the National Health Corps and then the ER doc. This was in Hilo, and this family didn't necessarily need healthcare that day, but they were just 3 children living in poverty with a mom who had suffered domestic violence. And they were not getting their vaccinations. They didn't have a way to have their developmental milestones measured. These are fundamental health questions. And so it made me think, what is healthcare? And in this case, healthcare for those individuals, which we always say, oh, well, let's follow the metrics, or let's find a pediatrician for them. If they didn't have a home, they didn't have healthcare. And it's why I often come back to these kind of topics, that housing is healthcare. And that's one of the moments where you see these beautiful children in Hawaii who are suffering the greatest of disparities, which is homelessness and isolation. So we go forward and we look at all the challenges that we face, and some things are traditional challenges. Now, I'm grateful to see you here, to see 400 people sitting in the same room, probably spreading a very low-grade COVID together. You won't be hospitalized because you've received the bivalent vaccination. and the first strains didn't take you down. But this is what we experienced, right? We experienced a success story because of the work of our Department of Health and great people and all of you as providers and our insurers who stepped up right away and said, we'll make sure people get vaccinated. It really worked. What we did is we went and looked at where people were most vulnerable. And we made a decision to follow the data. And when you look at the data, you can see the comparisons between Hawaii and other places. Now, did we have some advantages? Of course we did, because people could be outside during the winter rather than clustered in office spaces or at the Capitol or, in places where they could not separate. But we also had other challenges. You would think because we have the highest rate of multi-generational households that we would have had a much higher mortality rate. Instead, we had the lowest mortality rate in all the country, except we were tied with Vermont, which really makes me mad because I lived in Vermont and I hate them now for tying us. But I appreciate them for helping to educate me. And they did a good job too, but we were able to use our principles that we cared about people first, that we encouraged them through science to get vaccinated. And so that's what this slide is meant to show. And look at that. Even though we have, interestingly, especially in the rural areas like Ka'u, where I worked for several years for Bay Clinic, and I want to thank them for their support over the years too. They helped show me what aloha was. We had a lot of people that are anti-vax in the rural areas, especially those areas, but we of the country and state in the countryside, but we had 81% of our people get fully vaccinated. Pretty incredible if you really think about it. And as you compare us to other states, I believe, personally, that's why we had a lower mortality rate. And it was because of you and people like Dara who went out there and vaccinated people in the community. It's just amazing to imagine going one by one, household to household, having a medical van that we funded out of, just good judgment over the years, supported, and then it translated into high vaccination rates and people surviving. And that's us masked at Queens, I think, going down the corridors, talking to people about what their experiences are and were. And we're so close to people. That's really why I believe people took to high mask wearing. At one point, we reached 95% of our people being masked in the state. Completely unheard of. Completely unheard of. I mean, you could go to other states, it was like 20%. And of course, they were really, really struggling. So it was an experience that we'll never forget. And it shows that public health matters. That's why I wanted to really talk about that. So for those of you who are in pure public health or who fund public health, and Judy has been fighting for ways to do that, it makes a big difference for us. That's how we're gonna survive going forward, because it's not gonna just be surgeries downstream, it's gonna be upstream things. I want to talk about another public health emergency and crisis we've had. Today, this is much more immediate. People said, what's your first challenge going to be as governor? Aside from finding the House and where the switches are and dealing with the legislature and all those things, it was actually a tragedy. We lost a plane. These are our healthcare heroes, and I want to send love to them, especially if any of them are from the organization from Hawaii Life Flight. So they were flying 27 days ago between Maui in the dark down to Big Island to pick up a patient within 15 minutes of where I practiced for 2 decades. And I'll tell you, it really came home because about 18 years ago, I was on call one night when a plane was flying to the Big Island to pick up a patient in North Hawaii very similarly, and it went down into the water, and we heard it on the radio. That's how small a state we are. So we remember these things, and these heroes are back flying again. But 27 days ago, a plane went into the water, and they had to go to a safety stand down. And much of that was psychological because you have to let people heal and grieve. Healthcare workers are patients also. We have to remember that. But that meant about a week into our administration, we potentially had no way to move patients from neighbor islands to Oahu, or from one neighbor island to another if there, say, was some additional care they could get on Maui, for a cardiothoracic question that they might have capacity for now. So it really showed us where we are at risk. And I will tell you that there are some announcements that will come in the next day or two to help us heal and get through the process. You'll hear about that in the news in the next day, I think. But The truth is, that was a catastrophe that we didn't anticipate. So we did an emergency proclamation. We worked with Department of Health. Libby Char was still our Director of Health, who is very dear to me. We wore Libby out, as we did to many directors of health in the last couple of years. And we came forward now with Kenny Fink, who has served as a Medicaid director, so he has experience, much like Judy has, and we're building a team that is health-based. We had to rely on other services, so our healthcare system changed in one moment. We didn't have time to reflect on what we could do over the course of legislatures or appropriation cycles or what have you. We had to immediately stand up emergency services to keep people alive. And people had aortic dissections, and there was suicide attempts, and there were traumas over the holidays, but this state stepped up. And so what we did is we had some additional planes flown in. We had jets flown in too. We used emergency rules so people could fly and serve here amongst us. We didn't want to ask the life flight personnel to have to work for a period of time because you can imagine the stress that was going on. So we licensed people on the spot, which you can do. We relied on other services. The Coast Guard stepped up. One Coast Guard jet flew 3 patients at the same time, which was pretty exceptional. So people decided to come together. And so we had the National Guard and the Coast Guard all together. And a lot of people wouldn't have known it because things seem quiet, and that's kind of the way you want a healthcare crisis to go. If people don't know something really bad is happening, it's probably a good sign that you're doing an okay job. So that's how we approach that. Now here's where we are today. Now, let's be clear, you're going to have a healthcare state now for the next 4 years, because spend all that time, thank you. Spend all that time working with dear friends at the legislature, focusing on these issues that really affect all of us. Healthcare is the great unifier in my mind. When you talk about what legislatures, red or blue states, anyone has to take up because it affects us all. It affects our kupuna, it affects our children. I often say this, I can be fighting over a $100 million question in the governor's office or in the legislature, but if my son or daughter has a fever of 103, that is way more important to me in that moment. And I think everyone would probably reflect on that if you've got kids or nephews or nieces, or even your parents are sick. That's more immediate. And that's why it unites us. That's why I think that as we go forward in this country, finding healthcare solutions means finding American solutions. And I want to really emphasize that. So what we're going to do, and what the Hawaii Life Flight incident showed us, which we knew all along, is we just have to provide more care for people in certain areas. Our rural areas, where the health disparities are the greatest, they need our help. So what you're seeing from me here, and I'm going to go back to that, is a $10 million proposal for 2024 and a $20 million appropriation for 2025, specifically to do loan forgiveness for any healthcare worker that works in the state of Hawaii, from a case manager who's providing healthcare to a nurse, an APRN, a physician, whatever our need is. Our professionals, you, will choose who those people should be, but that's how we become not just the health state, but the health state that provides care at all times. So we've already proposed that, and I do think now, in the wake of this crisis, people will actually take it to heart. Now, we've proposed this before. We created this already and have funded this at about $500,000 a year. So the program exists. But we've never really gone the full distance on this. We've always known we have these needs. We know that the JABSOM students would love to have loan forgiveness so they could go into primary care. But we haven't done it because conceptually, healthcare has all it needs to most people. But we know now that it's clear we don't have all that we need. We need to care for people. You'll see an appropriation for $50 million for capital improvement to Hilo Medical Center. Why? Because that's the biggest hospital on Big Island, which has the second largest population, which, by the way, has an elderly population that needs the hospitalizations there. And we don't want to be flying them to Oahu if they don't need to, because then they're separated from their family and they can't get well. So that's the reason for these things. And then just to make Judy's life more difficult, I'm going to appropriate $30 additional million to be matched by, I presume, $35 million so that we can equal the Medicare payments, so that we can drive Medicaid compensation and reimbursements up, so that when people decide to care for people, thank you. So when they're my colleagues, like they have been for many decades, and let me give special kudos right now to the community health center people here, because you've been fighting that fight more than most for decades, though many of our private providers do, of course, see a lot of Medicaid individuals. As we've seen poverty surge and the pandemic, our numbers for Medicaid have gone through the roof. I remember years ago when it was 252,000 people in the state of Hawaii, 1 out of 6 on Medicaid. And Judy, what's the number now? 400,000? It's 460,000, 1 in 3. So it's, without putting too fine a point on it, it's doubled. And what does that tell you? It tells you society is struggling. And if we can help society in this way, we can do so much good. So we're going to improve this system. And as we get further downstream, you will see more and more that healthcare and healthcare need completely tracks with human need in our state. So we've done other things. The wisdom of the legislature was shining last year when they created this office, an Office of Wellness and Resilience, to deal with health disparities and to provide trauma-informed care and deal with the impacts of COVID. The secondary impacts of COVID may very well be as big as the primary indications that we've suffered, because we know people have PTSD from being isolated and worrying about dying from something that was unforeseen before. So we have this office now, and it's going to be with you. It's going to be going to your programs and to the departments across the state. And so every time we have an opportunity to provide trauma-informed care or that perspective, we'll do it. We've already hired Tia, who helped form this office. So you'll see us launch this, and it's really a luxury at this moment. Not a lot of states can do this. A lot of states are struggling to even grasp that trauma-informed care is necessary, and we have an office sitting inside the governor's office where you have a physician who really believes in what you do. Now, this is where I kind of diverge a little bit from healthcare to housing. And look at where we are from a housing perspective. We are 36,000 units at least short. That means people are going to either be homeless or they're going to leave their families. That's what this means. And if we wanted in our dreams to suddenly solve this problem, we couldn't do it unless we had incredible buy-in from all the people across the globe to tell them, you just can't buy property here until our local people have bought it first, which may be unconstitutional, but is probably the right thing to do, okay? Yeah. In truth, I have not often let the Constitution get in the way of my proposals, so we'll see what happens. But it means that we're going to take this on. We're going to fight to make sure people actually have housing. Those who are struggling on the street will see us intervene first. Those who are in the middle class are going to see major tax breaks so that they don't have to suffer both poverty and lack of access to health care at the same time. So all of it's connected. Now, housing, these are individuals that have been homeless in Waianae, and it should not be lost on anyone that 10,000 people a day in our beautiful state, about 1%, are without a home. Now, 2,000 people are chronically homeless. 10,000 go in and out of the state of homelessness, but 2,000 people have addiction, have mental illness, have PTSD, have been traumatized, and they can't break the cycle unless we change the system. So what we're doing, and this was a picture, I think on Thanksgiving, because I'm wearing an apron, which is not normal for me, was to go and be with the Hawaiian community. My wife is Hawaiian, right? And she's Japanese, and we're multicultural. That's how we are in Hawaii. But the Hawaiian part of her and her family are the people that live in poverty. It's always the case if you really look at things. And so
This is where we're headed. This is where our focus will be. You could see the disproportionate percentage of people who are both Hawaiian and homeless. It's always double, if you want to really know the truth. The rate of incarceration for people is double if you're impoverished versus if you're affluent. The rate of chronic illness, double, and comes 10 years earlier if you're Hawaiian. The rate of incarceration, double. The rate of houselessness, double if you're a person of color anywhere in the country. And in our state, it's if you're Hawaiian. And so that's why we focus on this right now. And many of you are doing great things. This is the big challenge we have in healthcare, in my opinion, in our state, to shrink that disparity, to once and for all figure out what do we have to do. Because it's not just genetic, it's zip code, right? It's where you live. It's Ka'u or Waianae or Waimanalo. It's not Kahala, Kailua, Kona. So this is what happens if you're homeless. It's a healthcare problem. You live 3 decades shorter. Average life expectancy, 53 years. If you're a rich white guy, 80 years. It's amazing. It's worse than pancreatic cancer as disease states go, okay? So that's the challenge. And how do you solve that? Well, you gotta do a lot of things, right? First, you have to shelter people. So kauhale, building small houses, supporting that with the private sector, getting health care to people at the same time. Housing is health care. Finding that way to once and for all get families out of that cycle, but also single mothers out of that cycle and guys out of that cycle. You just have to keep doing it. And we'll get there because I'm in control of the budget now. So this is what we're looking at. This is the total of our necessary operations, and we have some money. We actually have, I think it's $1.6 billion to decide how to spend this year. It goes up to $2.8 billion as of next year. You know why we have that surplus? Because the feds gave us a bunch of money. Thank you, Senator Schatz. Brian is the bomb with his teams. And also, we were able to weather COVID and bring people back safely. So we got about 85% of our economy back when everyone else was in deep trouble. So we have this money now. Probably should have spent some of it in the last 2 years, but I'm kind of glad that we have it now, though, because the priorities are going to be this. So here you go. This is a number I've often used. It's a little old now, but historically, just the message should be clear. A very small sliver of those who are struggling consume a ton of our Medicaid budget because they're really in trouble. But that was when we only had 250 to 300,000 people on Medicaid. Now we have 460,000. We still have the challenge that a smaller percentage consumes the most health care, but now it's becoming a whole society, a whole challenge to actually look at what we will do right. And so our high utilization can be addressed. And if we address it well, with cultural competency and housing and prevention and trauma-informed care, it starts to shrink, and the budget gets a little easier to manage. And this is where I will share politically, if you're a real hardcore red stater, right? I got some uncles that are pretty tough to deal with, okay? If you tell them it's a good investment, they got good hearts. They'll say, okay, we'll follow the investment, and we'll get people well. You save the money, invest it in, they want tax breaks, but I say healthcare and education, we work that out. If you're a radical like my mom, she says housing is a human right. Buy housing, build housing, but do what you want with it. Just solve the problem. So here's us actually talking about kauhale. And for perspective, once again, look what it costs if you are completely in trouble. If you have to go to the state hospital because methamphetamine put a bunch of holes like Swiss cheese through your brain, and you also have acute psychosis on top of chronic disease, you got diabetes, and you're in the state hospital and the roof is leaking on you, $300,000 a year. $300,000 a year. If you're chronically homeless and you're back and forth to IHS and you're on the street, you have to cut some of your toes off because you get a staph infection, you're diabetic, $80,000 a year. If you're in prison because you couldn't make bail reform is actually health care if you really think about it, because going into the joint, you're not going to get a lot of health care. And it's a problem. right? By the way, we're looking for a medical director for the prison system, if any of you guys are available. I'm not kidding. It's going to pay well, too. I'm just told to tell you that. And then if you form a kauhale, you build a kauhale for $8,000, that person is not only housed, but their alcohol and drug consumption drops 60% in the first month. They don't have to self-medicate. They don't need opioids the same way they did. And you spent $8,000. Everything else is gravy. And they might see their grandkids. We talk about therapeutic, right? That's healthcare. So this is what we're talking about. I believe this picture on the right was one of our COVID clinics, right? I think, yeah. I'm not that fat. That's just how the shirt drops there. And that little boy, he had a nursemaid's elbow. And after his elbow was repaired, which is quick, he was able to do a high five. And so healthcare could be that little dude in one of our critical access hospitals, which we need, or it could be this mom who had 8 children, if I remember correctly, and literally could not get just down the street to get her COVID vaccination because she had 8 kids. I mean, I got 2 kids, and I can't get down the street half the time, right? By the way, happy birthday, Maya, who's 16 today, which is kind of great. So we look at healthcare in these terms. This is the story of Auntie Charlotte. There's Brooke. She's my chief of staff. She put this picture in here, I think, because she wanted to show off her legs. I have to be direct. Brooke is the bomb. The woman sitting next to her was naked in the streets, named Charlotte, and Brooke discovered her, was just out for a jog or a walk or something, and called CORE, a very thoughtful program started by the mayor and Jim Ireland, who's one of our dear friends, and they picked her up and they took her to our kauhale, which we spent $8,000, like I said earlier, to build the house, and someone else did it because I told some private person to give the money, right? And so this is what happened to Charlotte. In 6 weeks, that's her. She was dying of her chronic disease, naked on the street, into her 70s, and there she is now. I mean, it is just incredible what can happen. And Charlotte would, of course, go to the hospital every 3rd day. And you know what that means. I mean, chaos, loses her stuff, we'll probably bill her $8,000 per stop because, healthcare is expensive and crazy. And there she is. She didn't spend any money on healthcare at all. We probably spent $500,000 less on Charlotte this last year. Even though she has chronic disease, she has, she's got some elderly challenges, and there she is, living a life, and people can visit her. So don't tell me that these social solutions aren't healthcare. So there's our right, there's our kauhale, there's a picture of it. There's Nani, who's just our superstar, I believe. And this gentleman up in Waimanalo, where the tents behind us are along the roadway. We're one car accident from a mass casualty up there. Everyone is pretty stoned, so they're not gonna get up, if a car comes down the road. But the moment you put them into a kauhale, they start getting better. And they start getting health care, and they can avail themselves of their Medicaid plan or their PCP. And so this is how we roll here now in Hawaii, the Kauhale Initiative. We talked to people about this for years, and then we just finally did it. We did it under emergency rules. I like emergency rules because there's no rules, right? But there are emergencies, okay? So we're gonna work this until we get real solutions long term. So it's a social respite. There they are, it's 12 communities. They don't cost anything. Charlotte, in the course of 2 years, 3 year savings, she practically pays for a whole Kauhale community herself. We had a guy named Gary who was, I think he was a United patient, who went to the hospital 231 times 1 year. And the only reason he didn't go 365 times is because sometimes he went at night and it would not count twice, right? And Gary was basically okay, had some issues, right? A little bit of mental health care needs, had a little bit of COPD, but he was in love with a nurse. And so he would go there to get health care. And so I was tempted to offer this nurse like $300,000 a year to take care of Gary, until I was informed it could be construed as prostitution, which I was not trying to suggest. I was trying to say it's healthcare. It's a different healthcare model altogether. But Gary could have been cared for better, and ultimately we did get him a lot of care. So we want to thank these partners. H4 carried the weight for all those years. HMSA funded them. Queens, Islands Hospice did a lot of great work. A lot of private people donated their time. Home Aid came together and built those. So these are developers essentially providing health care. And then we sent people. You know, Hui Aloha came together socially, and we volunteered. A bunch of us volunteered as nurses and docs and so on. It just works. So as I come down the stretch here, you know, I wanted to just sum up by saying, when I think about healthcare, this is what's rattling around in my brain, right? I'm thinking, okay, on the outside, it's access to healthcare, getting providers here, making sure we have good systems, social workers get you the right place, just have enough providers in general. Housing and food security. If people are starving, they can't function, their kidneys fail, they're likely, if they're unhoused, to have all these problems that we just talked about. And then a living wage. If people can finally afford to live and not go from job to job to job, then they don't suffer all the consequences. I don't know if you guys know it, but median income, you know, right down the middle here in the state of Hawaii for a family of four, $113,000, okay? That's the median. Poverty is $32,000. Technically, that's the technical definition of living below poverty. But up to about $60,000 or $70,000, you're an Alice family, meaning you're in deep trouble. And so that's where living wage really comes in. Gotta find a way to break that cycle. Otherwise, it will be Medicaid City forever, which I support because I think that is an excellent way to care for people. But if you deal with minimum wage and you deal with affordable child care, affordable child care, people don't live in poverty, they don't have hunger or homelessness, they don't have that $500,000 lifestyle on the street, which is no lifestyle at all. Provide telehealth for the neighbor islands. Deal with drug addiction for real. It's primary care. It's primary care. Deal with this, solve this problem, this puzzle, and we're in business. So that's what you're going to see for the next 4 years, if I may. Since I'm writing all the bills from our office, this is the kind of stuff that we're going to do. But again, I'll say this. I only can do this because of you. And because people in Hawaii care about each other, because we're willing to think of things differently. This is aloha. Looking at this, thinking about people in terms of what their lives are, rather than just what their billing code is, or what their insurance policy number is, or whether or not they're white or Asian or Hawaiian. We think about their true self and what their needs are, and we get there. So I will pause there, I believe, and just say, hey, I can't believe I'm governor, but thank you for all of it. Okay. So there is a version of this picture with me wearing a Darth Vader helmet, which we haven't actually released to the press yet, but maybe we'll leak that on Halloween next year. So if I can take a couple questions, if it pleases the team, I'm happy to. First up, gets free healthcare forever.
How can just a regular old person in the community support these initiatives? We're just regular old people above us are making decisions, although you represent the people. What are things we can do to tell our auntie or cousin we can do this, reach out, write this person, email us, just one question we can do.
So the back door I'm using now, because Jamie got so mad that I gave everyone my cell phone, okay, is my personal email. So I've shifted from personal cell to personal email. And we will share with you immediately where you can volunteer, where you can donate, where you can contribute your organizations, Mana'o. And we will connect you because we're going to build 12 kauhale. We're also going to, thank you. And we're going to do other things. We're going to fund Medicaid more. We're going to fund prevention. And we're going to actually rebuild the public health system with a lot of resources, particularly for behavioral health. I will tell you that right off the bat. That's going to be our number one focus. I'll share something interesting with you. I spoke in front of all the freshman legislators yesterday. Their number one issue was not housing, it was not taxes, it was behavioral health. Their number one issue, and there's a lot of them. There's like 15 freshman state reps and a couple freshman state senators, and they are a reflection of society's, commentary, basically, because they just got elected. And it's mental health care, mental health care, mental health care. So think about that. This is an opportunity for us to really take a look at where our priority is going to be in health and in our state. Of course.
How can we help the small private practices across the state so that we don't have healthcare deserts for them?
Thank you. Kelly asks, how do we help the small healthcare practices around our state so we don't have deserts, healthcare deserts? Well, one thing that we're doing and that's been proposed is to get rid of the taxation on food and healthcare. And I think there's a good chance that it can pass. That would help quite a lot. I think the second thing you have to do is you have to reflect on how we actually can successfully recruit people. And it's really hard, right? Because when I came to Hawaii, I was 30, I was still pretty shy and a geek, and so I didn't have a wife or anything, right? And I went and lived in Ka'u where there was nobody. But I didn't worry about the public school system because I didn't have any kids yet. I didn't worry about a lot of extra sparkly things because I was just a regular person, like with a Jeep, that's it. So it's easy once in a blue moon to get someone to go there, but you never can sustain it. The time I was at Bay Clinic, of the 19 healthcare providers in the 4 years, 18 of us left. 18 out of 19 over 4 years because it was challenging, because it was hard work, because it was Medicaid reimbursements, it was a lot of things, right? So we make the health centers glorious places, like they are doing at Waianae. All the health centers are amazing, but look how nice they are now. They're really improved. That's one way. I really believe in this, and someday maybe I'll be proved wrong, but I believe if we tell people out there that anyone who comes to provide health care in Hawaii will have their loans forgiven, anybody, provided you also care for our people, which means Medicaid and Medicare, which amounts to half of our population, basically, then we're going to pay for your medical debt. And I don't think there'll be any deserts at that point. But it has to be that straightforward. It has to be really simple. So I cautioned even my dear friend Dr. Withy when we said it'd be hard to pay that many loans. That's because we haven't yet flipped the switch on the mindset, which is to say this state will have no medical debt for people that come. And at that point, we probably will fill up, I have to believe. It'll create some interesting new and good challenges, like I have too many pediatricians on Maui. Great problem to have, right? I have too many people that want to practice neurosurgery in a place that's far away. Great problem to have. So that's what I'm hoping. Okay, last question?
Last time I saw you, you were lieutenant governor.
I just got an eraser is all I had to do.
Looks like you're having fun, but how can all of us in this room here help get more funds for these great initiatives through private and public partnerships, financial partnerships? Because we all know a lot of rich corporations are here, and these healthcare initiatives are amazing. So how can we help your office connect those?
Okay, so the question is, how can we help actually connect the private public partners together? I will connect you to our Office of Economic Development. I will connect you to our directors of health or Medicaid. I believe actually that, well, Hawaii, for example, has 5 of the 10 wealthiest Americans that exist living here in the state now. I believe that when we do certain things like promise to pay back everyone's healthcare debt, that we'll have someone say, I'll match it, if you'll also put them in my community, if you'll help me that way. I believe that people, when they see we build 3 kauhale to help 200 people, they will say it only costs $2 million, let me build 3 also because I'm a rich guy or woman and I want to do it. So I believe this is going to happen. I also think that the era of matching funds is here to stay. We've seen that as a precedent with the feds on a lot of things, but we've never completely turned the corner. Now, the reason H4 was pretty successful and those kauhale were successful is because actually we raised over $8 million directly from HMSA, the hospice entity, and Queens. And all I had to do was come up with a building. So it was perfect, it was like dollar for dollar match. But I, fortunately, who have no money, basically, because I got a 16-year-old daughter, right? So I had land, and so we can do that. And I think all across America, we have land, we have some capacity. We have to have the will. That's what we really have to have. And the money and the expertise will follow. But thank you guys. Thank you once again for this day and for all the days that came before.